You wake up, and before you even open your eyes, you already know your mouth feels like it's lined with cotton. Your tongue sticks a little to the roof of your mouth. You reach for the glass of water you've started keeping on your nightstand. Because this isn't the first morning this has happened, is it? You drink. It feels better for a few minutes. And then sometime before lunch, that same dryness creeps back in. If that sounds familiar, I want you to keep listening, because what I'm about to share may change the way you think about that dryness, not because it's something to be afraid of, but because after 60, a mouth that stays persistently dry is sometimes your body's way of pointing at something else, something that has nothing to do with how much water you drank yesterday. I'm Dr. Robert Vance. I've spent a long career in internal medicine. And if there's one thing I've learned from sitting across from older adults, it's this. The symptoms people mention almost as an afterthought are often the ones most worth exploring. Oh, and my mouth's been dry lately, but that's probably nothing. I can't tell you how many times I've heard some version of that sentence tucked in right at the end of an appointment after we'd already covered the blood pressure in the knee and the refill request. And more often than people expect, that probably nothing turns out to be a thread worth pulling. So let's pull it together, you and I. I want to walk you through why persistent dry mouth after 60 deserves a second look, what it might be connected to, and just as important, what it does not automatically mean. Because I want to be very clear about something right from the start. I am not here to scare you. Dry mouth does not mean you're seriously ill. Most of the time, there's a manageable explanation, but manageable and worth understanding aren't the same as ignore it. My goal today is to help you become a better observer of your own body, so that if you do bring this up with your doctor, you're bringing them something useful, a pattern, not just a complaint. Let me tell you about a patient I'll call Eleanor. She isn't one specific person. She's a composite built from patterns I've seen play out again and again in my practice. The kind of story that lets me show you how these small clues fit together without pointing to any one person's private history. Eleanor was 67, active, sharp, the kind of patient who came prepared with a list. For close to a year, she'd been waking up most mornings with a mouth so dry it was almost uncomfortable. She kept water by the bed, same as you might. It helped for a little while. She figured it was just part of getting older. Something she'd read about, something her friends joked about at lunch. Dry skin, dry eyes, dry mouth. Getting older is drying, isn't it? That was the story she'd told herself. But here's what Eleanor hadn't quite connected. She'd also started avoiding crackers. Toast, too, unless she had coffee to wash it down. She hadn't thought much of it, just a preference, she told herself. Her dentist had mentioned almost in passing that she'd had 2 new cavities in the last year, which was unusual for her. She'd gone a decade without one. And her mouth felt sticky sometimes, not just dry, a kind of tackiness that made talking for long stretches uncomfortable. Each of these on its own seemed minor, nothing urgent, nothing that felt like a reason to call the doctor. That's exactly the trap I want to help you avoid, because it's rarely the single dramatic symptom that gets missed. It's the quiet accumulation of small, disconnected ones. Before we go further into Eleanor's story, I think it's worth pausing on something most people never think about: what saliva actually does for you. We tend to think of it as just wetness, an inconvenience when there's too little, mildly embarrassing when there's too much. But saliva is doing real work every single day, mostly without you noticing. It helps you taste your food properly, believe it or not. Flavor molecules need moisture to reach your taste buds. It helps you chew and form food into something you can safely swallow. It contains enzymes that start breaking down food before it even reaches your stomach. It helps protect your teeth by neutralizing acids and washing away food particles, and it plays a role in keeping the tissues of your mouth healthy and resistant to irritation and infection. When saliva production drops, even gradually, even partially, all of that quietly becomes a little harder. Chewing gets a bit more effortful. Swallowing dry foods gets less comfortable. Your risk for cavities and gum irritation can go up, even if you're brushing exactly the way you always have. None of this happens overnight, which is exactly why it's so easy to miss. Now, here's something I want to correct, because I think a lot of health content gets this wrong, and I don't want to mislead you. Water is not the enemy here, and water is not useless. If your dry mouth is genuinely related to not drinking enough, and for some people, especially on hot days or when they're less active than they used to be, that really is part of it, then yes, drinking more water absolutely helps. Please don't hear me say otherwise. What I want you to notice is a different pattern. When you're drinking reasonably well, staying hydrated by any normal measure, and the dryness still comes back day after day, week after week, that's a different situation. That's not a hydration problem anymore. That's more likely a saliva production problem or something influencing saliva production, and water can only do so much to paper over that. Refilling the glass gives you relief measured in minutes. It doesn't address why your glands are producing less in the first place. That distinction, temporary relief versus an unaddressed cause, is really the heart of what I want you to take away from this conversation. So what could be behind reduced saliva production? Let's go through this the way I would with a patient, not as a checklist to diagnose yourself with, but as a set of possibilities to help you notice your own pattern more clearly. The first place I look honestly is the medicine cabinet. This surprises people every time, and it's one of the most common and most fixable contributors to persistent dry mouth in adults over 60. A remarkable number of very ordinary, very commonly prescribed medications list dry mouth as a side effect. Certain antihistamines, the kind many people take for allergies or used to help with sleep, can reduce saliva production. Some antidepressants have this effect. Certain medications for overactive bladder do too. Some sleep aids, some blood pressure medications, depending on the specific drug. And a broader category of medicines described as having anticholinergic effects, which includes some allergy medicines, some muscle relaxants, and others are particularly well known for this. I want to be careful here because I don't want you walking away thinking every medication in these categories definitely causes dry mouth in every person, or that you should stop taking something because of what I just said. Please don't do that. Never stop or adjust a prescribed medication on your own, even if you strongly suspect it's contributing to your symptoms. What I do want is for you to become aware that this is a real and common possibility, common enough that it's usually the very first thing I explore with a patient describing persistent dryness. Here's what makes this more complicated and more relevant the older we get. Many older adults aren't taking just one medication. They're managing several for blood pressure, for cholesterol, for sleep, for allergies, for mood, for pain. Individually, each one might carry only a small risk of contributing to dry mouth. But side effects can add up. The combined effect of several medicines, each with a mild drying tendency, can be more noticeable than any single one would be on its own. This is sometimes called medication burden, and it's exactly why a full medication review, prescriptions, over-the-counter medicines, and yes, supplements too, with your doctor or pharmacist can be so valuable. Not to eliminate anything reflexively, but to understand what's actually contributing and whether there's a reasonable adjustment or alternative worth discussing. This was in fact one of the first things that came up when Eleanor finally brought her symptoms to her doctor. She was taking an allergy medication nightly that she'd started years earlier and never really reconsidered. It wasn't the whole story, I'll get to that, but it turned out to be one meaningful piece of it. Now let's talk about timing, because I think this is one of the most underused clues people have available to them, and it costs nothing to notice. Is your dry mouth worse specifically in the morning, easing up as the day goes on, or is it fairly constant, present most of the day, regardless of what you're doing? These two patterns can point in somewhat different directions, and knowing which one describes you is genuinely useful information to bring to a doctor. Morning predominant dryness, waking up parched, even if you were reasonably hydrated the night before, often has something to do with how you're breathing while you sleep. Many of us shift into mouth breathing overnight, sometimes because of nasal congestion, sometimes because of sleep position, sometimes for reasons we're not even aware of. Mouth breathing dries out the oral tissues directly, simply through airflow, the same way your lips get chapped on a windy day. If this is happening to you, you might also notice waking with a mild headache some mornings, snoring that your spouse has commented on, or feeling unusually tired during the day despite what felt like a full night's sleep. I want to be very careful with what I say next, because this is a place where fear-based content does real harm. Dry mouth in the morning does not mean you have sleep apnea. It absolutely does not prove that. Most people with morning dry mouth do not have a serious sleep breathing disorder. But if that morning dryness is showing up alongside loud snoring, if your partner has ever mentioned pauses in your breathing or gasping sounds during sleep, or if you're dealing with real persistent daytime sleepiness that naps don't fix, that combination, that pattern is worth mentioning to your doctor. Not because it's definitely something serious, but because sleep-related breathing issues are both underdiagnosed and very treatable once identified, and a conversation costs you nothing. Then there's the pattern that honestly I take most seriously when I hear it, and I want to walk through it carefully rather than rush past it. If your dry mouth is showing up alongside noticeably increased thirst, drinking far more than usual and still feeling thirsty, and alongside more frequent urination, especially waking up multiple times at night to use the bathroom, that specific combination can sometimes be associated with elevated blood sugar. I need to say this plainly and carefully. Dry mouth by itself does not mean you have diabetes. It is one symptom among several, and on its own it proves nothing. But that particular trio, persistent thirst, frequent urination, and dry mouth, appearing together is a pattern that deserves a conversation with your doctor about whether blood sugar testing makes sense. It's a simple test. It's not something to lose sleep over. It's something worth ruling in or out, because if it does turn out to be relevant, catching it earlier rather than later genuinely matters. There's one more pattern I want to walk you through because it's less commonly discussed, and I think that's a disservice to people who are experiencing it. If your dry mouth is showing up alongside dry eyes, not just occasional irritation, but a persistent, gritty, sandy feeling, like there's something in your eye that never quite goes away, that combination can sometimes be associated with a condition called Sjogren's disease. This is a condition where the immune system affects the glands responsible for producing moisture, including the salivary glands and the tear glands. I want to be very clear. This is one possible explanation among several. It is not common, and having dry mouth and dry eyes does not mean you have this condition. Plenty of people have both symptoms for entirely separate, unrelated reasons. But if this combination describes you genuinely persistent dryness in both your mouth and your eyes, not just once in a while, but as an ongoing pattern, it's a reasonable thing to raise with your doctor, because proper evaluation is the only way to actually know what's going on, and there are effective ways to manage it once it's identified. Let me pause here on something I hear often, because I think it deserves an honest answer rather than a quick dismissal. People sometimes ask me, doesn't everyone's mouth get a little drier as they get older? Isn't that just normal? And there's a kernel of truth in that. Saliva production can decline somewhat with age, on average, across large groups of people. But here's the distinction I want you to hold on to. A gradual, mild, barely noticeable change over decades is a very different thing from a persistent, bothersome dryness that shows up now that you can point to that's affecting how you eat or sleep or talk. Some decline is common with age is not the same statement as your specific noticeable symptom is nothing to look into. Those two ideas get blended together far too often, and I think it does people a disservice. Age can be part of the backdrop. It's rarely on its own the whole explanation for a dryness bothersome enough that you're keeping water by the bed and still waking up parched. I also want to spend a moment on something people tend to underestimate. What persistent dry mouth can quietly do to your oral health and your daily comfort, even if it turns out not to be connected to anything more serious. Saliva is one of your mouth's natural defenses. It helps wash away food debris, neutralizes the acids that bacteria produce, and helps keep the delicate tissues in your mouth resilient. When saliva is reduced for a sustained period, the risk of cavities can go up, even in people who have gone years, like Eleanor, without a single new one. Gum irritation can become more common. If you wear dentures, reduced saliva can make them noticeably less comfortable, sometimes leading to soreness or a looser fit, because saliva plays a role in how well dentures adhere and how the tissue underneath tolerates them. Chewing can become more effortful, swallowing certain foods less comfortable. Some people quietly start avoiding dry or crumbly foods, crackers, toast, certain meats, without ever really naming that choice to themselves. Eleanor did exactly this. It wasn't dramatic. It was just a slow narrowing of what felt comfortable to eat. And over months, small narrowings like that can add up to something that affects both nutrition and quality of life. This is why I don't want you to think of dry mouth as a cosmetic annoyance, something to shrug off simply because it isn't painful in the moment. It's connected to your teeth, your comfort while eating, and through those things, connected to your independence and your day-to-day enjoyment of life. That's worth protecting, regardless of what the underlying cause turns out to be. So let's talk about what you can actually do with all of this. I don't want to leave you with a list of frightening possibilities and know where to put them. I want to give you something practical. The first thing I'd ask you to do costs nothing and takes very little time. Pay attention deliberately for the next week or two. Notice when the dryness is at its worst, morning, throughout the day, or after specific meals or medications. Notice roughly how long this has been going on and whether it started around the same time as a new medication or a change in dose. Notice whether you snore, whether anyone has mentioned pauses in your breathing at night, whether you're unusually tired during the day. Notice whether you're thirstier than usual or using the bathroom more at night. Notice whether your eyes feel persistently dry or gritty. Notice whether you've had any new dental problems recently or whether you've quietly started avoiding certain foods. None of this is about diagnosing yourself. It's about gathering the kind of information that turns a vague complaint, "My mouth's been dry," into something specific and genuinely useful for your doctor to work with. I'd also suggest doing one more thing before your appointment, and it takes maybe 15 minutes. Sit down and write out every single thing you take, every prescription with the dose if you have it handy, every over-the-counter medicine you reach for regularly, even something as ordinary as an allergy pill or a nighttime sleep aid you don't think of as real. Every supplement and vitamin, even the ones you've taken so long you've stopped thinking of them as anything other than habit. I ask patients to do this constantly, and almost every time, something on that list turns out to be relevant that they wouldn't have thought to mention out loud. Your memory in the middle of a 15-minute appointment is not as reliable as a written list sitting in your hand. This one small piece of preparation can make the medication review conversation dramatically more productive. When you do bring this up, here's language I'd suggest using because it tends to open the conversation productively. I've been having persistent dry mouth for the past several weeks, mostly in the mornings or throughout the day, whichever is true for you, and I'd like to talk through what might be causing it. Could we review my medications, including anything over the counter, to see if any of them might be contributing? That single question, asking for a medication review, is, in my experience, one of the most productive things a patient can bring into an appointment. It signals that you've thought about this, and it gives your doctor or pharmacist a clear, concrete place to start. While you're working on getting that conversation scheduled, there are supportive steps that are safe for most people and can genuinely help with day-to-day comfort. Continue drinking water regularly throughout the day, guided by whatever fluid recommendations are appropriate for your individual health situation. This still matters, even if it isn't the whole answer. Sugar-free gum or sugar-free lozenges can help stimulate saliva production for some people, and because they're sugar-free, they don't add to your cavity risk the way a regular mint or hard candy would. There are also over-the-counter products specifically designed for dry mouth, sprays, gels, and rinses that can offer relief. If you use a mouth rinse, an alcohol-free option is generally more comfortable for dry oral tissue than one containing alcohol, which can be irritating. Keeping up with regular dental checkups matters more, not less, when you're dealing with persistent dryness, since your dentist can catch early changes before they become bigger problems. If your bedroom air tends to be very dry, particularly in winter, a humidifier can sometimes ease morning symptoms related to mouth breathing. And if you use tobacco in any form, that's worth discussing with your doctor as well, since it can worsen oral dryness and irritation considerably. None of these are cures, and I want to be honest with you about that. They're comfort measures and reasonable ones while you and your doctor work out what's actually driving the dryness. If a medication turns out to be a contributor, there may be alternatives worth discussing, or your doctor may decide the benefit of staying on it outweighs the side effect with some of these comfort measures used alongside it. If it turns out to be related to your breathing overnight, there are effective evaluations and treatments for that. If it's connected to blood sugar, that's something you can act on with real established tools. If it does turn out to be an autoimmune cause like Sjogren's, there are ways to manage it and protect your oral and eye health going forward. In almost every direction this can go, there is something constructive to do. That's really the message I want you to sit with. I do want to mention briefly, when dry mouth crosses into something that needs urgent attention rather than a routine conversation. If you experience sudden severe difficulty breathing or swallowing, signs of a serious allergic reaction, sudden confusion, severe weakness, chest pain, or any other sudden severe symptom that calls for emergency care right away, not a wait-and-see approach. But I want to be clear that this is not what typical, gradually developing dry mouth looks like. For the overwhelming majority of people experiencing what we've talked about today, this is a bring it up at your next appointment or schedule one in the coming weeks situation, not an emergency. I don't want you carrying unnecessary worry out of this conversation. I want you carrying clarity. Let's go back to Eleanor for a moment, because I think it's worth seeing how this actually plays out when someone brings the full picture to their doctor instead of just the one symptom that finally felt worth mentioning. When Eleanor sat down with her physician and laid out the whole pattern, the morning dryness, the new cavities, the avoided crackers, the nightly allergy medication she'd been on for years, her doctor did exactly what I'd hoped for. They reviewed her medications together and identified that allergy medication as a likely contributor and discussed a reasonable alternative. They asked a few more questions about her sleep and her thirst, and those didn't point toward anything further in her case. Her dentist adjusted her care plan slightly, with more frequent fluoride treatments given her new cavity risk. It wasn't a dramatic story. There was no single dramatic diagnosis, no crisis, narrowly averted. It was simply a case of small, previously disconnected observations coming together into a clear, manageable picture, and Eleanor leaving that appointment with an actual plan instead of a vague sense that she was just getting older. That, more than anything, is what I want for you. Because here's the truth I keep coming back to, year after year, patient after patient. Growing older does not mean you have to quietly accept every new discomfort as simply the cost of aging. Some changes really are ordinary and truly don't need to be chased down. But persistent changes, the ones that show up again and again, the ones that start affecting how you eat or sleep or feel day to day, deserve to be understood, not dismissed. Noticing a pattern in your own body and bringing it to the right person isn't anxious behavior. It isn't overreacting. It's exactly the kind of attentiveness that helps people stay independent, comfortable, and well for far longer than they otherwise might. I'll leave you with the same thing I try to leave every patient with because I think it captures what I actually believe about all of this. Your job was never to become your own doctor. You don't need to diagnose yourself, and please don't try to. Your job is simply to notice, to pay attention to the pattern your body is showing you, and then to bring that observation to someone qualified to help you make sense of it. That's not a small thing. That noticing is very often where real answers begin. If this kind of conversation is useful to you, the kind where we take a symptom that's easy to brush off and actually think it through together, carefully and without panic, I'd invite you to subscribe because this is exactly the kind of thing I want to keep exploring with you. And if any part of what I described today sounds like your own mornings, I hope you'll take that as your cue, not to worry, but simply to pay a little closer attention and to have that conversation the next time you're in with your doctor. Take care of yourself. I'll see you in the next one.